Vitamins and Depression by Jessica Davis. There hasn't been much thought put into whether vitamin deficiencies can cause depression in patients. However, there is a link in vitamin deficiencies and a patient's overall health condition. Vitamins are important for patients because they can help in different areas of a person's life. For example, all B vitamins are important to the body because it helps the patient's chemical balances in the brain. If a patient has a vitamin B deficiency, it can possibly cause severe and unfixable damage to the patient's brain and nervous system. Another example of how vitamins affect a patient's body is a vitamin D deficiency. Not only do the patient's bones get weak and brittle, but it can also damage the patient's brain as well. The vitamin D receptor is found in many different areas of the patient's brain, such as the cingulum cortex and the hippocampus. Both of those areas of the brain are implicated when dealing with depression as well. To know if vitamin deficiencies can cause depression, one must understand what depression disorder really is. Depression affects a patient's body as a whole, with its symptoms such as tired, unhappiness, anger, loss of interest in fun activities, anxiety, isolation, inferior performance, whether at school or at work, muscle aches, suicidal thoughts, drug abuse, or alcohol abuse. This disorder, however, starts in the patient's brain. Most depression patients need to have the chemical structure of their brain looked at so they will know if they have depression. There are neurotransmitters in a person's brain which are made up of serotonin, dopamine, or norepinephrine. These neurotransmitters affect how a happy person feels, whether it be happy, pleasure, sad, or angry. In patients with depression, the neurotransmitters that make a person feel happy and pleasure are not in balance, so they end up with depression disorder. This is why medications such as antidepressants are used to treat this disorder, because they work to help stabilize these neurotransmitters to make the patient better. Therefore, the research topic that needs to be answered would be, is it possible to treat patients with vitamins for depression? Is this treatment going to help the patient overcome this disorder without having to take antipsychotic medications? Research question at hand. Can vitamin deficiencies cause a patient to become depressed? Why is this topic important? This topic is very important because it could open up a new way to help people with depression. Depression is a horrible disease that hurts many people in different age ranges that doesn't fit in the age range for normal medications. Plus, the normal medications have side effects that could cause patients more problems than the normal vitamins would do. A literature review. In an article by Everts states how important vitamin D is in treatment of patients with the depression disorder. This article covers a study done on 63 outpatients that aged between 18 and 60 years of age. These were people that had been diagnosed with major depressive disorder. However, they didn't receive patients that had disorders such as post-traumatic stress or obsessive compulsive. Patients that were pregnant, had substance abuse problems, lactating, neurological disorders, psychotic, bipolar disorders couldn't be in the study as well. Patients who had vitamin D levels of 25 OHD of 21 29 ngmls were considered as deficient in the vitamin D levels. If patients had 30 ngmls or above, they were considered normal levels in vitamin Ds. They found that 98.5% of the patients had low vitamin D levels. It was also proven that the vitamin D levels were more so low in the depressive patients. Another study showed by Zsuzsi Sepala that the vitamin B12 levels also showed that not only was depression a problem for the United States, but it's a global problem as well. Depression accounts for 8% of the total disability adjusted life years, dailies is what they call it, in America, and 6% of the dailies in Europe. Around 12% men and 24% women in the United States have depression. Depression is linked to many different neurotransmitters such as serotonin, which vitamin B12 deficiencies can lead to an accumulation of these neurotransmitters and can enhance depressive symptoms. Potential methods that can be used for this research test is possibly pre-test, post-test control group design, mixed method, PAR. For the pre-test, post-test control group design, it was picked as the best type in the quantitative group because the pre-test, post-test control group design, according to Sutter, is the strongest design because all of the participants of the pretest before they are entered take a pretest before they are entered in the research program. The pretest also sets a personal baseline for each participant so they know if the treatment is working for them. The pretest post-test control group is the best way to ensure that the participants that are in the study fit the type of study that it is being done. In the article by List states that knowing the treatment for the participant should be simple enough. However, it sometimes needs to be questioned whether that the treatment is the best. That is when research studies come in. It is impossible to observe a patient at all times. However, if that patient would to participate in a research study that could give an observant in more than one state simultaneously, that is when the pre-test, post-test control group design comes in. Not only are they observed before the study begins, but they are observed while the study is in progress as well. Then to follow through, they are observed at the end of the study to help make sure that the variables stay at the minimum. This would reassure that the patients did come into the study with a vitamin deficiency, and by the end it would show if their vitamin deficiency was under control along with their symptoms of depression. With the mixed method, the triangulation makes a research study stronger by strengthening the validating. It does that by being able to use different methods of data collection that leads to similar findings of some results. This type of design would give great strength to the study of the vitamin treatment for depression. This would give the researchers more design to use with both quantitative and qualitative designs. By mixing these methods, it helps open doors that would be closed if a researcher would only use one or the other design. With PAR, out of these designs is a wonderful way to help empower the participants and to help them receive an enhanced quality of life according to Puntrillo. How PAR works is you get a group of people that are affected by the same problem, then help them figure out a way to fix that problem based on what you have learned about research designs, options, and requirements in this course. Created an opportunity research approach and designed to investigate your research question. PAR would be the best approach for the research of vitamins for the treatment of depression. The reason for that would be that it would bring patients that all have depression and a vitamin deficiency together to fight for the same cause. If this treatment showed to work, then they would have gained a better life for not only themselves but for the whole community of patients that suffer from depression because of the lack of vitamins. Ethical issues. The ethical issues are all stated in Section 8. As you can see, informed consent to research, debriefing, and human care. I plan to make sure all of these ethical issues are addressed by ensuring safety for every person involved. Also, ensure not to release information or do anything without written consent from people involved. Con- Conclusion. It is clear there is a link between vitamin deficiencies and depression, but there isn't a lot of research to prove the link yet. That is why it is important that this research be done to help more patients overcome this illness. If vitamins can help treat this disorder, then the patients with this disorder deserve to have that treatment available to them. References used. References continued.